Good afternoon and good evening to all of you. I'm delighted to be here. My name is Anisa Mburu. I am a second-year GYN oncology fellow at Moi University. I did my undergraduate in University of Nairobi, which is in our nation's capital, and my graduate studies followed through in Cyprus and in Moi University. Well, I got involved into the Moi University fraternity back in 2010 when I started my internship. And Adrian, I can share a few slides maybe?
Sure.
Okay, so just, I'm a visual speaker, so bear with me. So this is a time when I was doing my internship, and some faces maybe are recognizable by some of you. This is when we were all young and sprightly at the time. And one of my other intern fellows went on to proceed with me to do obstetrics and gynecology. And of course, most of you know Dr. Koskei, who's doing his current fellowship in MFM. And of course, Dr. Miller, who also came, and during my internship and residency, we quite rotated with her. Now, one thing that really struck me into GYN oncology at the time, that's, as Dr. Elias said, that's when the program was being formed. And I was the intern at the time, and Dr. Rosen had just come, and that's the time I first got to meet him. And I had the honor of doing all the skirt work as the intern on call. And my very first night, I was called to resuscitate a patient with advanced cervical cancer. And no one had told me that it's usually futile for most of these patients. And I ended up giving it my all, but patient died. She was 24 years old. She was not HIV positive. This did not sit well with me. I did not understand it. And from there on, it kind of made a switch in my life and in my career. And I really needed to understand how this could happen, what we can do to prevent it. And of course, I took up my residency in my university because to me, I knew there was a gynecology fellowship program there, and that's what I targeted. And from there, I finished my residency in March of 2019. And in September 2019, I started my gynecology fellowship. So people will always ask, why gynecology? This is a very depressing field. And for sure it can be, especially in LMIC, as Dr. Eli has alluded to some of these things. We have quite a big challenge, especially when trying to get some drugs that we would want to use, some of the new modalities that are available. There's some surgeries that we'd want to perform that we're not able to. And we are very limited in this process. But that has made us quite innovative. And with time, it has even given us more determination to help these patients. So this is a patient of mine that I want to share her story with, and through it, it will give you an idea of how it is on the ground in the gynecology fellowship. So I met her in my residency when she was just a 24-year-old, and she had been sent in from a different facility. They had done a suboptimal surgery for what was an ovarian malignancy. So we had to reoperate on her. And of course, this causes a lot of delays. And it's one of the main challenges we face as GYN, and in fact, literally the only GYN center in Eldoret, where we serve a catchment area of about 20 million people. So we have so many patients coming in, they've been suboptimally managed in different facilities, and we literally have to start from the beginning. So we have to reoperate them, and this causes, of course, a lot of delays in initiating the appropriate therapy, and it also costs a lot, costs money to the patient, which most of the time is not in good supply, and as well as causing a lot of morbidities. Well, for this particular patient, we ended up, as we operated on her, it took us about 3 weeks before we got our pathology report. Now, again, another challenge that we face, because at the time we only had 3 pathologists in MTRH, about 3, maybe 4. And as I say, they're serving a catchment area of about 20 million. So we can't have a very high turnover in terms of our specimens. So by the time we get the pathology report, it's vague and very inconclusive. We do not have a subspecialist pathologist who's trained in gynae-oncological pathology. So some of our reports will always end up being a bit vague and inconclusive. But nevertheless, for this patient, we started on chemotherapy. And as she was doing her chemotherapy, she had a lot of delays. Number one, at some point, her health insurance ran out. And of course, it caused a bit of delay before she was able to get it back and continue on with the medicine. And then she had some grade 3 hematological toxicities. Blood setup is very difficult to get. So by the time we're able to transfuse her, get her back to do good, get rid of her bone marrow suppression, it also delayed the chemotherapy. But at least she finished her chemotherapy, and 6 months when she was undergoing her follow-up, she comes to the clinic again. And one thing we need to mention about our clinic is we only get to have one clinic once a week. And in this time, we can see up to about 50 patients. That's a very high number. Up until last year, we'd only be about 2 fellows at a time. So imagine you have these patients. Some of them, you're going to tell them that they have cancer. Others, you're telling them that they're not going to make it. The chemotherapy has failed, or there's no other options for them. And you still have to you have about 50 patients waiting. So we've not always been able to give out the care that we would want to, have the time to talk to our patients. And we're still trying to address this. We've got more fellows who have joined in, but it's something that has really been quite challenging for us. But for our patient here, she's come back, she has 1 ovary, and luckily she was pregnant, something that she really, really wanted. And she was happy about it. We linked her up with an obstetrician. And unfortunately, at about the 3rd trimester, we noticed that she was having a mass in her other ovary. But she went on to deliver a healthy baby, and her insurance had run out again. So it took her about 4 months before she was able to get it back. And we were able to scan her and operate on her again. And for sure, the cancer had recurred. But now we had to remove her uterus and her remaining ovary. So now we have a 27-year-old who has no uterus, has no ovaries. And we told her now we have to deal with effects of menopause. And of course, that is something very difficult in our setup because we don't always have all these hormones available to us. But her response, as long as she's alive to take care of her baby, he can handle whatever comes along. And to me, this is one of the most gratifying things in being in oncology, having to meet such brave women who are able to take on the challenges and face them on ahead. So now, this case has just highlighted some of the challenges we've faced. And I want to say that the best thing about it is that we've not been alone in our journey. And we've had excellent mentorship from our founding fathers, Dr. Itsura, Dr. Omenge, and Dr. Tonui. They've always been there to guide us. And of course, we've had immense help from our international mentors, Dr. Rosen and Dr. Covens. We literally want to put them on a pedestal because, especially with the COVID pandemic, they couldn't travel to us. We couldn't do our exchange program. So from April of last year, we started doing our COVID sessions, we call them. So every twice a week on Tuesdays and Fridays, we'd have sessions with Dr. Rosen, Dr. Covens, and we would discuss our difficult cases, discuss topics on oncology. And through that, we were able to maintain our learning. So despite COVID, we still continued learning. We were able to get our new fellows to join, and we were able to even compare management in a low resource setting like ours and a high resource setting like theirs. And through this, one thing about this fellowship that has been quite uplifting also is, if I can make a reference to my Tolkien fellow fans, the fellowship is never ending. We have those who have cleared, who are practicing in different areas in Kenya. But during our weekly tumor boards, they'll always join in. We discuss our cases, we talk about the challenges they're facing, and they also encourage us as the current fellows to continue on. So this fellowship of ours is literally binding for life, so to speak. So it has really, really helped our situation. Another perk of being an gynecology fellow in Moi University is that we have gotten enrolled in the IGCS fellowship program. This is the International Gynecological Cancer Society. And through this, we meet with several other fellows in different LMICs like Mozambique, Uganda, Ethiopia, Vietnam, and even Jamaica. And we get to talk to them, discuss cases, discuss the challenges they're facing. And sometimes when we have similar challenges, we'll be like, you know what, they handle this in a certain way, and we can actually apply this. And of course, once we finish our 2-year fellowship program, both in Moi University and IGCS, we get to be accredited internationally. Of course, we probably won't practice in different countries, but at least we have that international, can I say, education, so to speak. Now, to finish, basically, with all these challenges that we face, we find that we still get a lot of patients. And right now, our presence is being recognized in all of Kenya and sometimes even Uganda. And we're having more patients coming in. Yes, we are saving a few, and we are able to help those who we cannot save at least have a better quality of life in the end. And that's why it's not all depressing and dreary for us, because as much as we know sometimes you're facing a losing battle, for this patient, that relative, we are able to make a difference in their life. And to me and to anyone who would be interested in joining an oncology field, I'll always say that is a gift that we cannot take lightly. And so if I may share a quote with from one of my mentors, it's something that has really helped in my life and in my career. It goes that, I shall be telling this with a sigh. Somewhere, ages and ages hence, 2 roads did diverge in a wood, and I took the one less traveled by, and that has made all the difference. This is by Robert Frost in 1920, and I hope you can, some of you can I say, recognize with this particular poem and maybe help you in your life. Ampath has really helped me in my life in terms of getting some grants for my studies, like the NIHU 54 grant and the preceptorship grant. So with this kind of forum, it's really great to show that with this oncology program, with all the things that are happening, there's a lot of lives that are being changed. So thank you again for having me. I hope I've not talked too much. All right, thank you very much.
Anisa and Ben, thank you so much. I think, you know, all of us who have spent significant amount of time, unfortunately, know and have been touched by someone with cervical cancer. And I think your story and your description and your obvious passion is actually very moving. And just shows how all of us working together can overcome all the barriers and the challenges that you've laid out. It's really just inspiring. So thank you very much for sharing that story.